Live. So now we're good.
Okay.
Preparing, setting up. Okay, great, we're on. There's going to be a little bit of a delay over there, but that's fine. So we finally made it on. Hi, everybody. Hello, YouTube. My name is Stacey Ray from A.R.T. And I am speaking with Christina from Living Story Tattoo in Columbus, Ohio. And today we are going to be talking a little bit about Chrissy has a great background in the medical field, and then she moved into doing restorative tattooing. And so she's experienced that from a nurse point of view, and then she took some training with a tattoo artist, and then she took some other training, and then she came to me for training. So she's got a lot of information to share here, and I just really love, Chrissy, I just really love your perspective on all of this. Yeah. So tell us a little bit about yourself. How long have you been doing this?
So I started doing like physician office training or tattooing rather in like 2007. And I did that until I left the doctor's office in 2015. So I had to unlearn a lot of things and bad habits. And when I actually went and trained with a professional tattooer. So I think I'm a kind of a strange little creature because I've been on both sides of the coin. And I have I've said this before to you, I have a lot of like regrets, like because I have a good amount of tattoos walking around Ohio that I feel shamed that I did when I was a nurse, right?
Try not to get too caught up in the shame of that, because that's one of the things that humbles us, and that's why this is such a humbling career. And this is exactly why we are so driven to encourage other people to invest more in their foundation so that they don't feel like that and they don't make the same mistakes we made.
Yeah, absolutely. I think when I worked as I'm a registered nurse, right? So I was working as a nurse employed in a reconstructive plastic surgery office. And then they just kind of said, well, you're Dr. So-and-so's nurse, so you're going to tattoo Dr. So-and-so's breast patients. And originally there was only one nurse in the office that did the tattooing, and she was taught by a physician. And so she never had any formal training or anything. And then, so she trained me. And then I had been doing tattoos for maybe a few years. And I kept going to management saying, these results are awful. I want better training. I want better equipment. I want better. And I kept getting told, no, these are medical tattoos. This is what we do. And finally, they gave me 6 hours of painful DVD videos to watch because I kept complaining that I wanted better education. And it was from like a permanent makeup place. I watched the videos, I sent this thing in, they gave me some type of certificate that was supposed to say I could do a good job. I didn't learn anything. Then I kept complaining, and we hired more nurses, and I was supposed to train them. I had no idea what I was doing. And then they brought a nurse up from MD Anderson that was supposed to teach us, and she did the same god-awful techniques that were on this video. So it's such a resistant like mindset to try to break through in a physician's office, because they get in like a trap, right? They want to finish their patient's breast reconstruction. I think they have their heart in the right place because they don't want to have to send their patients out. They want to be able to provide that for them. But in actuality, they're not doing good. They're doing harm because they're turning loose these untrained nurses and such to do this procedure, and they're not tattooers. And don't get me wrong, nurses are great people. I'm a nurse. I love nurses. Yay, nurses, good. They love humanity and they want to do good for people, but they may not be artistic. They may not be able to draw a hangman, much less a nipple. And it's just a bad situation. And it's a kind of a trap that these physician offices get in all over the country. It's like they have like these nouveau contour little permanent makeup deals, right? That cost a lot of money. So these doctors invest a good amount of money. And the rep or whoever sells them this, and then the special cartridges that only fit this special machine, and they're very expensive. And then the inks, which are like, I don't know how much, $60, $70 for these tiny bottles. And they're semi-permanent makeup formulas that happen to be in like areola colors. So it's just the perfect storm when you take like the tightly configured needles that are really, really, they're, it's like a tight, I would compare it to like a liner where you're trying to do a whole, a surface area with this little tiny needle. You're going to abrade the tissue. You do a pass. You don't see any color go in. You're like, oh, I can do another pass. And they keep going over the tissue. They macerate the tissue. They abrade it up. And then they're like, oh, I need to press harder because I don't see color go in.
This is, oh my gosh, this is, I get really passionate about this topic.
Right. And I know I'm like, blah, 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 blah. And I'm just like throwing out because I used to do that.
This is true, and it causes harm. Now, the thing is that if you don't know anything about tattooing because you've never taken any training, because that physician probably hadn't taken any training, what qualified him to train? Then he trained the nurse, what qualified her to train? We get this like blind leading the blind, and everybody just doing what they're told and not actually questioning anything, and then they're causing harm. And then we see the survivors after. We deal with that mess. We hear about the messy divorce that came because she hated her body so much she wouldn't have sex with her husband. We see the scar tissue that cannot be fixed. We see the worst of the worst. We know, I don't know if you saw, but some of the girls from NIP over in England did a survey, and they found that 38% of people who receive a nipple tattoo are less happy with themselves, some to the point of being suicidally depressed. There is a real effect of the quality of life happening here that the medical field is like, la la la, not my fault. I'm just doing what I'm told. La la la, not my fault. And I'm like, oh my God, how is this allowed to happen?
Well, and then it's very strange too, because when you think about these big plastic surgery conventions and things like the ASPS or the ASPSN for the American Society of Plastic Surgery Nurses, these massive conventions, and people go and they kind of talk about the same thing, right? Like, oh my gosh, my nipple tattoos, like they're not really good. I wish they were better. And then it turns out that they're all using the same equipment and they're all buying the same type of ink because, and then they hear these lies. I don't know if they hear them from reps or whoever, the people that sell the products probably, but they're like, well, our inks are safer than tattoo inks. Tattoo inks are not safe. Lies. I mean, it's just depending on what brand, right? You want to make sure that you use a trusted brand like World Famous. Like you want to make sure that you, you invest time to make sure that you're using quality inks, but find me a permanent makeup line that's safer than World Famous. I dare you. So, but because they're not educated, they only know, they like hear things and then they regurgitate it. They don't really understand it. They're just repeating it. But so then when they talk at these conventions and stuff, they're all kind of doing the same things. So I think like we were talking earlier, because everybody's doing this, even though it's not right, it's accepted because everyone's doing it. And somehow they just think, well, you're going to go get this tattoo from my nurse, and then you're going to come back and you're going to get a touch up in like 6 weeks. And then you'll probably have to come back like every year and get another touch up. And this is accepted practice. No one questions it because it's just like status quo. But it's awful because like you say, creation of scar tissue, more damage. And then this lady who believes she's going to walk in and see a nurse and get a beautiful tattoo and she's going to be whole and complete again, looks like she has a pepperoni bullseye on her chest. Holy depression, because that takes her down lower than she was when she walked in your door. And this happens across the board, right? Like England, it's over there, it's here, it's like across the board.
Yeah, I did a show and tell at Broad Day with my breast reconstruction. So I usually support Breast Reconstruction Awareness Day, but this time I decided to go in the show and tell and actually show people my breast reconstruction, my tattoos, my scars, and actually talk to people about my experience with it before my reconstruction failed, because I don't know if you know, my implants were recalled, my reconstruction failed, I had to go with aesthetic flat closure, and so now I'm kind of permanently disfigured, which just it fires me up a little bit more to inspire some positive change in this field because of the effect that I'm seeing. So this lady comes up to me, she's like, oh, I love my tattoo. And I took a look at it and I'm like, okay, yeah, that's cool. Like the colors are in there evenly enough. Like it doesn't look anything like a real nipple. It doesn't. But I mean, the colors are in there evenly enough. It's not choppy. It's not like, it's passable, I guess, from 6 feet away or whatever. And then I was like, do they both heal evenly? And she goes, oh no, it's a unilateral. And I was like, oh, okay. I'm like, you don't have to say yes to me on this, but I'm like, may I see both of them compared to each other? If you're comfortable, if you trust me, you don't have to, but if you trust me, I would love to do a comparison.
Yeah.
And this is by the receptionist of my surgeon's office. This is how they feel, is like a receptionist. Yeah, you could be a tattoo artist now, as if tattooing wasn't its own career. So it looked nothing like her real nipple. Her real nipple was like very light and honey colored. And this was a big, like dark pink, like orange with a hard edge. And it was a completely different place on her breast, even though she didn't have like it, like they could have put it anywhere and they totally put it crooked. Now, how do we educate the public on, or the survivors, the community of breast cancer survivors, on that not all nipple tattoos are created equally, without sounding, because I just sound mad because I am.
Yeah. Well, of course. And you have every right to be mad, right? Because you had kind of like a poor tattoo experience initially, and then you had that made better, and then your implants failed, and then like you've been a lot. So you versus me, like you've actually been through this, so it's rightfully like justified that you're angry. I think the internet is a very good tool, because women now are, when they're ready to get their tattooing, they're kind of hungry, right? They're hungry for information. They're wanting to be educated. They want to know. And we can't leave it in the hands of whatever pamphlet the physician is handing to them, because they're only going to push what they do in the office. But I think the more, can you hear me okay? Okay. I think the more education that people have available to them, where they can learn like, hey, I actually have a choice. I can go to a professional tattooer that's dedicated a good portion of her life to perfecting this and providing a service that's good and won't hurt me and won't make me disfigured. Because I've tried to talk to surgeons about it. Just here where I'm at in Columbus, a lot of them are receptive, right? And they refer me patients, but the ones that do it in-house are resistant. They will not change. They will not send that business out. I have a feeling it has to do with reimbursement, because they bill the insurance company for the procedure, and then each subsequent time you get a touch-up and things done, they bill the insurance for a procedure until the insurance gets pissed and then says, I'm not going to pay for this CPT code again because you've had it paid out too many times. So then they provide the patient with a quote, like, okay, you're going to have to pay me this much. And then eventually she will pay out of pocket and continue to do so because she doesn't know any better. So the ones that are doing the tattooing are not going to be receptive to us. But there are surgeons here in Columbus that don't offer it. And those are the ones that send it to me.
So how do we get through to the surgeons that are doing this, that they are going against their oath to do no harm? It's a question of ethics at this point, in my opinion.
It is. And it's kind of like the $1 million question, right? I've gone to their offices, just personally. I've dropped off pamphlets of information. I've shown them, I have like these laminated before and after pictures, real quick zoomed in close-up pictures, a lot of corrective work, right? I'm like, oh, look at this pepperoni that came in my office. I believe she's one of your patients. And look at her tattoo now. She loves it. They're not receptive to any of this, right? Because they probably hate me. But I've been there, like I foot trafficked, like I drove to all these places. I don't really know. I don't know how to get through the physicians unless it's from other physicians, because there have been, like, for instance, one female doctor that does mastectomy. She's a surgical oncologist. She saw for yearly checkups, these gals come back in for their surveillance, right? Oh my gosh, who did these tattoos? They look beautiful. Well, then the lady tells her, she calls me for information. I bring some cards to her office. Well, then she does the mastectomy portion with multiple different plastic surgeons in town. She has sent, I don't know if they talk to each other like over top while like they're sewing, in the OR, but she's sent my information to a few different reconstructive doctors that previously had never reached out to me before. And I owe her that. She's great. She's great. Her name's Naomi Chen. She's wonderful. So I think that might be one route to go, right? If you can get in with the surgical oncologist that removes the breast, they don't have any skin in this game. They only want their patients to be good. They only want them to be happy, and they see them back for surveillance to make sure their cancer has not recurred. So that might actually be kind of smart, because they don't have any financial gain by it. So then if we can convince them, then they will tell the plastic surgery counterparts, like, hey, this is better. That actually might be a good idea. Yeah.
That sounds like a good idea. I don't really understand how a reconstructive surgeon, like a breast reconstruction surgeon, can want to spend so much time doing this beautiful reconstruction. My reconstruction looked great before it failed. It was great. I loved my body. I was pretty happy with it. It was a little bigger than I kind of agreed to, but that's a whole other conversation. Because just the medical field isn't really taking the care of us that we think that they are in some cases. And this is one of those cases. So why wouldn't they want something that looked, if they did this beautiful reconstruction, why wouldn't they want something artistic and permanent on it? Yes. Now I got you. This is something you're passionate
about. Because like you say, why are you going to invest, right, as a surgeon, your skill, your time, with these ladies, and you're doing a really lovely breast reconstruction, and why are you going to come on and slap a garbage tattoo on top of it? You've ruined it. You've ruined all this work. And not only have you ruined your work, but you've ruined that human being. Like, you've ruined her self-esteem. That's the bigger problem, right? So I don't really know. Like, I have some tried and true, physicians that refer to me, and I'm so thankful for them because they trust me and they know I will only do good for their patients. They know that. But the ones that don't want any part of me, they don't want any part of me. They don't want any part of anybody like me. They only want to do it in-house. So that's greedy and it's shitty. And it is what it is. And I know that because I used to do that. So I have every right to say that.
So, and I appreciate your honesty, and I don't know if this is the right word, but I appreciate your tenacity with wanting to get the word out, to continue this conversation, to help educate people. How do we put the power in the survivors' hands? Can we empower the survivors to go to their surgeon and say, let me see photos of your work. I want to see it fresh. I want to see it 6 weeks old, 6 months old, 6 years old. I want to see proof of your merit here. How do we empower breast cancer survivors to demand proof of merit? And then suggest, why don't you hire somebody who does have proof of merit? 6 months, 6 weeks, 6 years is great. 5 months, that's a triple number. I don't want to learn that. Let's say 4. We'll go on that one. But you know what I mean? Like right. That, like early on, like, I want to see how this is going to age. I want you to tell me, because you're showing me pictures of your breast reconstructions. So why aren't you showing me pictures of your tattoos? And why do you think that I'm willing to accept this low level? Like, why do you value me so little?
Right.
As I'm like, that sounds really harsh, but it is, because you and me are seeing the aftermath of this.
Yeah. And I feel like, we do have to empower them, because at this point, at this stage in the game, they are a consumer of a service, right? There's not an urgency like, oh my gosh, I have a cancer, I have to get it out now, and then I need to have my treatments, my adjunctive therapy, chemotherapy, whatever. Like, that's all a whirlwind of scary, and there's not a lot of time to sit down and process and make decisions, and you get referred to people, and I think I've never been in that situation. I would imagine it would be terrifying. I've heard people come in my office and tell me how terrifying it was. But at this stage of the game, when you're all done and ready and you're ready for those tattoos, you have the opportunity to be educated, and you have the opportunity to make the right decision, because it is a choice. So you choose, and a lot of times it does unfortunately come down to a financial choice. I think I've had so many people call me and be like, well, my doctor does the tattoos and he'll do it under my insurance and, you know, blah, blah, blah. But then I have to pay you. So I can't really afford to pay you. So then what I say to these ladies is, I understand if you're not in a financial point where you can come to me. I can appreciate that. However, please save my card, because in the future, I may need to do some, I mean, I say it, I hope they don't think I'm a terrible human being, but I tell them, like, please save my card, because in the future, you very well may need my services. And at that point, it's going to be more difficult, because I have to correct damage that may be done to you in your office. And I tell them honestly, like, I used to do the same kind of tattooing, perhaps where you're going, or it doesn't matter where you go. It's all the same. All these nurses and physicians and front desk people or whoever are doing it in the office, they're all doing the same thing. It's basically the same equipment. It's basically the same ink. It's the same technique. It's all garbage. And the result is garbage. And that's not right. You're a human being. Like, you deserve way better than that.
If I weren't, let me just interrupt you there for a second, because that's a good. And I think that if I wasn't a tattoo artist, and I had already, before I had my mastectomy, because I knew it was coming, I knew that it was coming. So, so before I had it, I went into training to do areola tattooing, and the training didn't make a lot of sense to me, as like I'd already been tattooing professionally for 15 years and like won lots of awards and magazines, all kinds of good stuff like that. And so when I went and took the PMU training, it really didn't add up to me. I was like, this doesn't make sense. This doesn't make sense. Right. That's not going to weaken the skin. That's going to cause damage. It doesn't make sense. So if I wasn't an experienced tattoo artist going into that after, like, I had a lot more personal power knowing what makes a good tattoo. So I understand like how terrifying that part can be for a survivor who just thinks that nipple tattoos are nipple tattoos. And if the person says 3D, then it must be the good ones.
Yeah. So my whole take on this, and like I said, because I've done both sides of this coin, is if you're going to tattoo someone's body, right? Their breast is part of their body. It is. You can't, there's no doubt about this. That woman's breast is part of her body. And if you're going to tattoo the body, you need to train with a body art tattooer. I'm very, like, this is something I believe in the core of my soul. Because, you know, our skin on our face is different than it is from the neck down, you know. The machine that people use is much like what the doctor's office use. The needle configurations are super tall and they're tiny, and they're very tight configurations, and they're small, and they're great for linear strokes, eyeliner, eyebrows. That's perfect. Good for you. It's not good for like, you know, a 2-inch circle, or like, you know, circular, like a surface area, because you're going to just tear up the tissue. So, and then talk about like your depth, how to work scar tissue. If you're a PMU learner, probably haven't worked on a whole lot of scar tissue, like maybe some facelift scars, or maybe if somebody has a scar through their eyebrow or they've been burned or something, but you're not doing scar tissue every single day, in and out, and you need to. If you're going to do, like, just with the nurses, right? I'm going to backtrack. If you're a nurse and you're like, okay, I do tissue expander fills, and I pull drains, and I take out stitches, and I call in medicines, and I do this Monday through Friday, but on Tuesday afternoon, I do nipple tattoos. Horrible nipple tattoos, because you're not devoting your time and your energy to learn and how to make your, like, it's your craft, right? So for me, and I've told you this before, I had to disconnect from the nursing world so I could devote myself to this, because I want to just do this, and I want to be good at this, and I want to be able to provide a service that these ladies deserve. So I had to disconnect from that so I could really make sure that all of my time and energy was going into just this. So,
well, and before you go on, it shows. That dedication shows. Your work is like, I share so much of your work because of the beauty of it, and I've really enjoyed watching you like develop a personal style. And I can see that because, you know, I've judged at tattoo conventions, and because I teach this, and so I know what to look for. And I'm just like, oh, she's just like, I can see your love in it. I can see your dedication to your craft. And this is going to sound probably a little bit harsh, but I feel like if you don't have that, you probably shouldn't be doing this. This isn't your realm of expertise. It's not your realm. It's not your area, you know. Like, I'm a tattoo artist through and through. My whole life is tattoos. I love tattoos more. It's my first love. It'll be my last love. I love tattoos.
Yeah.
And I feel like if you're not willing to spend, 10 hours a week drawing, doing homework, studying this, studying that, dedicating yourself to your craft on your own time, then you probably, that's the dedication it takes to really master your craft.
Right. Drawing. And then too, like for me, when I first went to my friend's shop, right, we basically asked him to kind of take me under his wing and teach me just fundamentals of tattoos. So learning the needles, like, hi, walking it, you want to, hi, this is my first coil machine right here. So he made me learn all these parts. And then talking like the needle bar, this is a needle bar, this is a tube, this is, you completely foreign. All I'd ever seen is a little cartridge, right? So he was very nice to me, and he was very kind to me, I think, because he was like, I have to kind of treat you with kid gloves a little bit. But he also made sure that I learned about, round shaders and a tight liner versus a more, like in a curved mag versus a straight mag. He made me learn just these fundamental things. And then I sat in his shop and I drew. I drew. And then I had latex, and I tattooed on latex. And then he would come over and we would kind of talk about things. So, and then I would sit quietly and watch him tattoo for hours. And I still, like, if I get a chance to go there, I like to sit and watch him tattoo. But he taught me different strokes, like doing, circles versus you can do like this little shovel stroke versus, when you do hit a scar, you kind of have to hit it from the side and don't go straight across of it and tear up the top, because scars are fibrous, right? But the top is fragile. So you can't just come along with this sweeping mag and hit this scar and tear the hell of it. So I'm very thankful for him. And then he told me, I don't do nipple tattoos, right? Except for on tiny little pinups. Like, I don't do real nipple tattoos. So you need to go find somebody to really help you learn that. But I'm forever grateful to him, and he's local, right? So if I have a problem, oh my gosh, if I have a problem with my machine, I take it to him. He still helps me. I don't know, but I think that's one of my things too that kind of makes me maybe, I don't know, unique, special, I'm not sure, but it's because I took the time to actually go learn, because I wanted to learn the right needles and I wanted to learn the right techniques and things. And then when he took me as far as he could, then I sought out help from experts in the nipples, because I want to make sure that I'm providing a service that they really do deserve. It's not a 2-day class like that, like from permanent makeup people, like what I had at Ohio State. It was just awful.
I love that you just described how much you engaged with your apprenticeship experience, because I believe that that's what's missing here. I believe that the trainers are responsible. I believe that the physician who taught the nurse who taught you and the nurse who taught you are responsible for your work. And I take that belief seriously by supporting the people that I work with, by being very choosy about who I work with, and then supporting them to their greatness, because that foundation is so much more important than people realize. They just want to stick it on. They just want to stick it on, and then everybody gives them a bunch of likes on Instagram and they're like, oh, you're helping people, you're so good. And that leads to the kind of outlook that, we see it down the road when that person hates their body so much their husband has left them because they won't be intimate with them. Like, there was one woman who said that she has a bath with a bra on because she can't handle looking at herself. I had a woman come in for an areola tattoo that still had stitches in and didn't even know because she refused to look at herself. So we see the real side of things. But what you were just explaining about the 2-day classes, it just seems really easy. Another certificate, another certificate, another certificate. And like you said at the beginning of this, those certificates mean nothing if that person isn't applying the knowledge. So then we get this problem of like microbladers wanting to do this and they don't even know how to use machines. What do you think about that kind of stuff?
I get offended. Okay, like, I'll just be honest with you. When I get somebody that contacts me and they've done microblading and they word it like this: I want to add areola tattooing to my list of services. That's offensive to me. because I'm like, this, what happens in this room? This is like a magical room, okay, right? Like there are feelings that happen in here. There's, you know, you're some women are scared, some women are you know, this is not a list of services. This isn't a paraffin hand wax. This isn't a manicure. This isn't an eyebrow tweezing. Like this is a nipple tattoo on a person that's been through hell and back, lost part of her body, part of her femininity, part of her sexuality, her confidence. You have a great job. Like this is a great responsibility to be able to restore something. And she's never going to be the same again. She's not going to be pre-mastectomy, but you need to try your damnedest to make sure that she's an acceptable, you know, appearance for her. And so I just respond back that, you know, no, I'm sorry, I don't train. And then I asked them, have you ever picked up a real tattoo machine? Have you ever done tattoos before? Have you ever even done permanent makeup with a machine? And if they respond no, I'm like, well, you need to go get basic tattoo training first, get a handle on that, and then maybe think about touching somebody that's been through a mastectomy. I'm kind of weird because I started out as a nurse first and did all that before I ever entered into this world. So I, you know, I maybe come from a different road, but I think the journey should all lead to the same spot, and the same spot should be doing no harm, right?
Yeah. Yeah. So I love that. And I love that you're from a nurse background, because I'm from an old school tattoo background. Like I'm talking old school, all the things that they make fun of. Even the guy who taught me how to tattoo, he played the tattoo artist in the movie True Romance, a really cool movie with Christian Slater and Patricia Arquette in it from the 90s. He was the guy who played the tattoo artist in there. So that's the kind of well, I can't please everyone and today's not your lucky day kind of attitude.
Exactly.
But it is still about work. Put the time in, get a solid foundation on healthy skin before you even think about dealing with damaged skin, because this skin will never behave like healthy skin.
Yeah.
So how do we get that message through to people who believe they have a transferable skill set, even though they don't?
That's the $1 million question. That's what's so hard, is because hopefully with a movement like yours, the ladies can get educated, and then PMU artists, microbladers, etc., can kind of understand the gravity of what the undertaking is. And you know, a lot of the guys at the shop where where I would go to learn with RJ, they would say things like, oh my God, I would never want to tattoo a woman that's been through breast cancer. I wouldn't want to hurt her. I wouldn't want to mess her up. You know, like what if she got an infection or something? Oh my God, I couldn't live with that. So there's so many artists out there that are so devoted to their craft, and they want to only do good to people, right? These tattooers, they know like that's not where they want to go. They're like, that is way too serious. That is way too scary. I don't want to hurt this woman. They know. But then other people are like, oh, I microblade. I want to do nipple tattoos. Let's do it today. So how is that like? There's a difference, right? There's a disconnect and a difference. And I think it has to do with maybe when you go in to do a true tattoo apprenticeship, you get told like, you're going to be putting in work. Like you're going to have multiple hard days where you feel like you're not ever going to be able to pick your head up off the pillow again and come back and show your face in this place, right? Like I saw it. They didn't do it to me so much, but I saw all the guys in the shop really get kind of raked over the coals, right? And it's not just a couple days. Like this is months and months and years of learning before you're turned loose on somebody. It's not like in the doctor's office what they do. It's criminal. It's criminal. But in the PMU world, people, you know, like you say, they get these really quick certificates and things, and then they just want to cut loose on ladies. And it just has to come, I think, from maybe education, and then showing like showcase more of the disaster work of what has happened, maybe.
So I think that is a good way to do it. So I think you asked what's the difference, and then you went into talking a little bit about what you see the differences are. In my opinion, respect is a difference. This is a humbling career, and
Mhm.
so when you learn really quick and you're not really taught what mistakes to avoid, or that mistakes can even be made when you don't even realize that mistakes can be made, then you really don't have the respect for the craft that comes from the humility of learning it right all the way through. And that's what
Mhm.
you would get in an apprenticeship or a practicum or nursing school. How long did you go to nursing school for?
4 years.
Exactly, 4 years. I spent
Mhm.
4 years working in a tattoo shop for no money, just to watch, same thing like you did, just watching, drawing, watching, drawing, watching, drawing. And then I spent a bunch of time and I did an apprenticeship, I paid for it, and it's like, it's
Yeah.
university. In my opinion, this is a trade and it's university. However, it doesn't have trade designation, so it has no regulation. And that's why you get all these people just trying to make a quick buck by handing out certificates. And this
Mhm.
year, I'm seeing an even worse thing happen because everybody wants to take online courses and then they think that that teaches them. So I'm actually seeing left, right, and center microbladers and like just people like, and I'm not dogging microbladers. It's just a completely different thing is all. It's just a completely
Mhm.
different thing. So, and, uh, and I'm seeing them take like digital classes where they're still not holding a machine or getting any kind of like hands-on training or any kind of like, no, that's the wrong way to do this. And oh, we look at you. This is how you recognize skin damage. This is what you need to feel and look for.
Right.
And now they're actually doing nipple tattoos with an online certificate. And they're like,
Yeah.
I've had a couple people like, well, I watch YouTube videos. I'm like, oh my God,
Right.
you cannot learn how to do brain surgery watching YouTube videos. You are way off base. And I don't know how to feel good about that.
Yeah. Well, and I just know from my own experience. Like I said, I had this nurse in the office, super kind woman. Like she was just such a she'd been there since God created time. She knew everything about plastic surgery. She was just a very sweet lady, but she wasn't a tattooer. She taught me the best she could, right? And then I watched these DVDs because that was like, we didn't really have YouTube and stuff then, but I learned nothing. And what I heard all the time at the tattoo shop is, how do you learn? Time in the skin,
Yeah,
time in the skin, time in the skin. And you know, that's more of a big deal, I think, than people understand what that phrase means if they've
right.
never walked into a tattoo shop and actually watched somebody learn, or be on the receiving end of learning from somebody, because it's um I don't know.
If it's time in the skin, if it's time in the skin, that is the key to learning. Then what that means is mistakes in the skin is the key to
Yeah,
learning.
yeah.
And then learning how to do things differently. And I think that that is the part that people are a little afraid to say, because nobody wants to be the bearer of bad news. Nobody wants
Mhm.
to, nobody wants to be the reason that somebody else is harmed. Like just nobody. So what we have is we have this kind of like this problem with everybody sugarcoating everything and pretending like
Mhm.
it's going to be okay and not actually telling you what can go wrong so that you can prepare for it. And then, like I keep saying, we see the bad side of that. And then I'm like, I got to hold the trainers accountable. Why are the teachers like, why are they accepting these students if the student doesn't have the foundation and blah, blah,
Mhm.
blah, which is fine. And we can talk about this till the cows come home. It comes down to regulation and that there isn't any. But how do we inform the survivors so that they can
Mhm.
also demand better from the surgeons who don't seem to care?
Yeah.
The surgeons are like, we want to do it in-house. Well, what if those survivors start saying, sweetie, that's not good enough for me? You can hire
Mhm.
a tattooist and then I'll come to your place and do it in your place of work. You can hire somebody
Mhm.
who's not only certified but qualified. And the
Mhm.
survivors need to be the people that are making this noise, because like you said, you went and talked to these people directly and showed them the difference, and they
Mhm. Oh, they
oh,
didn't.
they didn't.
Yeah,
Yeah,
they didn't want anything to do
they
with
don't want
me,
anything.
which is, I don't know. It's disheartening, right? And it's not like, I don't take it personally, like maybe they didn't like me or they didn't think my work was good. It's greed is what it comes down to. And that is so shameful. Um, and again, I just know this because I used to work in a plastic surgery office. So I know, and I told you the one time the lady, I think they had her sign an advanced beneficiary notice stating that her insurance company wouldn't say that they were going to pay for the tattoo, unilateral. $1,350 that they were going to charge her if her insurance denied it on the back end. $1,350. So think about that. If she hasn't met her deductible yet, they're going to bill her that.
So how can they think, with no training, minimal education, horrible tools, that their service is worth that? They are not supercuts. This is
No.
not a $6 haircut. This
No.
is somebody's confidence.
Mhm.
And this is exactly why I get so passionate about this. So I was going to say that. So up in Canada, so my prices are high in our team. My prices are like, I think, the highest of what our team is. I charge $600 for a unilateral, $750 for a bilateral. And I do that because I don't think there's anybody really who knows more about breast cancer tattooing than me. I went to art school, been tattooing 25 years, been, I just, I've had the mastectomy, which I've worked with the surgeons, like all of that. So I don't think that this service is worth more than what I'm charging. So what makes them think it is? Now I charge $750 because that's what Alberta Health was paying the person who did it, like the receptionist at my surgeon's office, without any training, without any, like, she's not qualified to do this.
No.
So they were charging $700, they would pay out $750 every time she did it. So they paid the office $750 to fix their own mistakes, but they just made the mistakes more and more and more. And then the people come to me and I'm like, your skin is destroyed and even I can't fix you. And the survivors aren't being told this, and it just breaks my heart. How do we get to the survivors and the medical field? Because I went to them and I'm like, okay, how about this? I will promise you that I can do this in 2 sessions. I will charge you half that price and I will help you benefit the survivors. And the medical field said no to me.
Oh yeah, I 100%. Yeah. It's again, it just comes down to greed. It has to. It has to.
So
now,
so I'm looking at, so if she does a client 5 times at $750 each, that's a big money amount. If I do it 2 times at $450 each for the medical field, because I get paid twice, so I can reduce it. And like, say I charge $400 like what I was charging the surgeons, and that's what I was doing. And I would do it twice. So I'm like, okay, it's like the money that they keep or whatever. I'm like, is on par. And so I am way less of a tax on the medical field. So the greed thing doesn't fit that. The greed thing doesn't fit that.
Then it's just obstinate at that point. Kind of like, well, this is like, for instance, when I kept going and asking for better equipment, better ink, better education, better, and I kept getting told no. I was getting told no because they were like, well, this is what we do. This is what we've always done. This is what UNC Chapel Hill does. And this is a long time ago. I don't know what these people do now, but this is what blah, blah, blah medical center does. And this is what we do. This is a medical tattoo. Well, that's garbage. So it's like they're resistant to change. They also have like incorrect information. They think that their PMU inks are safer and that they're FDA approved. They're not, right? I mean, the FDA, obviously, if something comes out like, like a red dye or something in an ink that we need to be aware of, the FDA will kind of send out this blast, right? And you get it from the health department, and the health department says, hey, if you're using any inks that has this ingredient in it, like da-da-da-da-da on this list, stop using them. So I'm sure there is some type of like overwatch of that, but I dare you to find me an ink that says it's FDA approved in the PMU world. I don't believe that exists. I don't know. It's so hard. I mean, and these are questions that I kind of think about, right? Because when I see the corrective ladies come in, especially the unilaterals, like you brought up the unilateral lady, I kind of still do, but I used to lose sleep over unilateral patients. Like if I knew I had one the next day, I would lay awake at night in my bed and be like, oh my God. Because that's so hard. you're not only having to match, you know, size and shape and placement because maybe the reconstructive versus the native breast is not quite 100% right. And you're having to trick the eye to find symmetry, and then the color, right? Color.
Yeah. But I
And
taught
then
you all my tricks, so now you feel confident in that, right?
I loved unilateral nipple tattoos are like my favorite thing to do now. They are my, now I still, don't get me wrong, I still kind of lose sleep over them just because I'm like weird and I, you know, that's part of me that probably won't ever go away, but I super love them. And I like to do the side-by-side pictures, right? Because you want to get those little intricacies about the nipple. Like you want to make sure that you're just trying to do a mirror image. But when you have this poor lady come in and she's got this orange, light pink, weirdly faded bullseye, and then over here she's got a completely different, like a natural nipple, how can you expect to ever think that that's okay for that woman? And then when you talk about PMU, when you get these, when you take a cookie cutter nipple class, we'll just call it that, where all the nipples look the same, 100%. They, you know, they have this circle, and then there's like a shadow, and then there's like a little bare spot, and then there's like pixelations, these little dots, and then like 3 little tiny U's. Well, nobody's nipple looks like that. That's like a cartoon nipple, but it's this replicated, I don't know, cookie cutter over and over again that no one's, so you can't do, how can you sit down and do a unilateral nipple when that's what you've been taught to do? I don't understand that. So, because you're supposed to draw what you see. And so what I do with unilateral nipples is, I'm short, right? Like I'm 5'3". So, I'd like to take a picture of their nipple, and then I at least have something to look at, and I study it.
Artists do studies for sure. Yeah.
But so I always tell people, like, if you're unilateral, I like to see your nipple before you walk in my door so I can study it, because you have to be prepared. You need to do your homework before somebody comes in so I can study and be prepared for you. That's part of honing your craft in, right?
You know, and I teach people a lot about this in my digital class. You know what would be good, actually? You know what would be good? And I do not do these interviews to promote myself at all. I really try to stop. Like when somebody starts giving me praise, I'm like, shut up, shut up, shut up. Like, just, this is not about me. However, if every nurse who does nipple tattoos did my digital class, if she's going to do them anyway, at least she'll have an idea of what is difficult and why,
Right.
and how to maybe do a little bit of a better job with that particular challenge instead of forcing that body to receive what she's been taught to give.
Yeah, that is true. That, you know, if you could maybe, like, maybe that would be a good way to present it. Like if you went to a physician's office and said, hey, I'm not asking you to completely abandon everything that you're currently doing, but at least can we train your nurse to try to get some type of drawing faculties. But I tell you what, when I was a nurse doing tattoos, there was originally it was just one nurse, right? Then she trained me, and then we had like 2 others that learned that I had to train. And these poor girls would be like, oh my God, today I have to do nipple tattoos. I hate doing nipple tattoos. I wish they wouldn't make me do this. I wish this wasn't part of my job. Oh yeah, because they knew their work wasn't good and they felt so guilty. But then when you went to our manager was like, well, I'm sorry, this is part of your job description. You either do it or.
Hold on. I have to stop you there. Like, before we get into it, the manager disagrees with it. The manager doesn't want to hear it. See, this is why I get so fired up about this stuff. Man, people are going to be like, I get really fired up about this stuff, because what would the survivor say to that knowledge? If the survivor's sitting out and she's like, I'm finally going to get my nipple tattoos and all of this horrible experience is behind me and I'm going to love my body again because I see on A.R.T, on the A.R.T and on the living story stuff, like what's possible. And I know that I'm going to get the best because my surgeon is the best. Meanwhile, back there, she's like, I don't feel confident doing this. I don't know what I'm doing. And he's like, get to work. What? Yeah. That's something worth changing.
all of that. Yes to all of that. But that's what these girls would do. And like I said, they were great nurses. They were great human beings. They loved being a nurse. but that doesn't mean you're artistic. It doesn't mean that you can do tattooing. And then they would see their work come back in 6 weeks for a touch up, which means it was gone, faded, awful scars. And they're like, this just sucks. Like, this is not a good thing. But we were told basically do it or find another job. And that's like, when you really care about the breast community as a whole, and you really like being a nurse and you like the physicians you work for, but then you have management telling you tough it up, do it anyway, it puts you in a very hard position. And I think that's kind of where I have like that guilt, because I wanted to do tattoos. I've always loved doing tattoos, and I love the idea of being able to complete a breast reconstruction and make someone feel beautiful and whole again. I loved that. I knew I wasn't doing that. And that's why I kept begging for better and get shut down. And finally, eventually, I begged my husband. I'm like, can I please quit my job? I carried our health insurance, right? So he took a second job so I could quit and go train. And I'm forever grateful to him for that. And I tell him all the time, like, he's tired. He works 6 days a week, and he'll get up and be just dog tired. I'm like, I love you so much. I love you. Thank you for busting your ass for me so I can go do what I love every day, because, it's amazing.
So that brings me to another point. I'm sorry, I'm so bad at interrupting. I'm really trying to get
Yeah,
better.
I know.
But that brings me to another point, which is, if the surgeons get paid to do their job and the nurses get paid to do their job, then it's not something that those of us who are willing to go and be above and beyond should be like, because I feel shamed by my peers as well. Like, well, if you're trying to help people, why are you charging? I'm like, because I'm an expert. Because
Yeah.
I'm an because I'm an
Yeah.
expert and I deserve to get valued for my worth. And I appreciate that you think that I should do this for free. So if you want me to provide this for survivors, then why don't you start fundraising? Why don't you get involved with helping me provide this for survivors? Because I can do the service, and I deserve to get compensated for the service that I provide.
Right.
So if you feel this way and you feel strongly enough about it, then please contribute. Please get involved. Please help me do that. I will work with you on that until the cows come home. But until that point, if the surgeons aren't working for free and I'm a surgeon level expert in my field, then you can't expect that of me. And I'm sorry that I can't give it.
Right.
As it is, everything that I make goes back into ART, and ART is here to educate and support survivors by educating and supporting tattooists to be the kind of tattooists that the survivors need. And we have a standard. We won't accept less than the standard. So if I am already investing everything that I have into that, then I believe that I'm giving more than I'm receiving. Then I'm giving more than I'm expecting to receive. And that is my gift to the world. So it really sucks that these people who aren't willing to see things that way are willing to accept $1,350 a session when they don't know what they're doing.
That's criminal. It's awful. I do, because I tattoo at one location is through Ohio Health, which is like one of our medical provider systems in Columbus. And I go there once a week on Tuesdays. And if they have any type of a breast like symposium or any type of, like, not during COVID now because the world's insane, but previous to COVID, they would send me invitations to come and have like a little table out, and that was my goal. And I would try to grab as many physicians as I could to educate them. And you could kind of see who was receptive and who wasn't. But so that's kind of one way, just me, that I've tried to do, is to reach these ladies, because they're going to these informational sessions. Sometimes it's like sex after cancer, right? Like that's one talk. Sometimes it's, like an intimacy kind of thing. Other times it's nutrition, like different types of support things. So anytime they invite me, I gladly accept, and I make time to go. And I block that time out, because if I'm able to educate somebody, then at least I can try to do some of the groundwork, to get in there and listen. And then when they hear, they go to the support group, and then they share that with their friends at the group. I did find out too, there are some Facebook pages that I've been talked about on that I didn't know were out there, right? Because I'm not part of them. Which one was like a phyllitis tumor. I might be saying that wrong. Tumor group. And basically, phyllitis tumors are like, they could be non-malignant tumors, but then they also can spawn malignancies inside the breast. I'm not super educated about them though. But this gal was like, hey, I saw your name on this phyllitis tumor Facebook group post, and I thought I would give you a call because that's what my diagnosis is. And I'm like, oh. So survivors are trying to, in their own realm, I feel like, get the word out, like by word of mouth. Like, I feel like they really are trying because they want their sisters to have a good experience. They don't want them to be feeling broken and disfigured.
So check this out. So I joined a bunch of breast implant and explant groups, of course, as I went through finding out that my implants were recalled and that I had to face an explant and that I wasn't a recipient for this or that. And like, it's just, I've been through hell and like a little bit, you know, just a little bit. People have had it worse, but I've been really engaged with the process. So I joined all of these these groups. And one of the things that happened was I went on there when I was like in a fear state. And I was like, oh my God, I'm having this fear. I can't work through it, you know, and I'm just having a hard time keeping positive with this because I'm really, really, really scared and hurting right now. And this lady comes on and she's like, well, if you knew how to do this and blah, blah, blah. And I'm like, I'm one of you. I am one of you. And so as much as there's some really great people in there, there's some really horrible people. And every time so what I see the most is people going in there complaining about their scars because they have more scarring than they realize they were going to have. You get a lot more scars from explant surgery than you do from implant surgery. And so I'm like, well, I'm a scar specialist, and here's what I would recommend. Like, this is kind of like what I tell people to do when I'm tattooing them. And the admins kick my comments off because I'm also a professional in this field. They think I don't have a right to share my experience, to share my knowledge when these women are asking for it. I'm like,
Right.
I am one of you. Why
Right.
are you rejecting me? I am one of you. I have the proof right here on my chest. There's no chest there, you know, like I am one of you. And then when I go to the PMU world and I try to talk to them about here's how you get better and blah, 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 they're like, they've been horrible to me as well. And I'm like, well, but I represent the survivor. I represent the client. I represent the person who's not being talked about, the person who's receiving the tattoos. So I would go to those surgeons that you're going to, and I would be like, I represent the person you tattooed. I represent the survivor. I am one of them. I also happen to have this skill set that bridges the gap. Why would I be the person you reject when I'm the one who has the knowledge from both sides? You know what I mean? Sorry,
No, you're fine. I'm sorry. I have a question. And if I don't ask it, I'll forget because you know me. So, like, let's say I have a corrective tattoo, and I've never done this before in the past because I wouldn't want to be on the receiving end of it. But like, let's say this tattoo comes in and it's awful. Then I always just say, like, this is a corrective tattoo. This is how this gal walked in the door to me. Here's my end result, blah, blah, blah. But I never state who originally did the tattoo because I just don't. But so maybe, like, is that wrong that we're not divulging who did the tattoo? Like, maybe, like, because I look back, like, before I met you, right? I trained previously, like, with some people, we talked about it. But I have people now who follow me on Instagram, and I did their tattoos like 5 years ago. And they say, hey, like, I like my nipple tattoos and they're good, but now you're doing all these magical little details and you're putting all this stuff in that I don't have in mine. Can I come have some things added? And back then I only did one visit. I didn't do 2 visits until I trained with you, right? So I say, yes, absolutely. Please come back. And then I add to them. So sometimes I look at even my work, not as a nurse, like when I was transitioning like into what I'm doing now, I'm like, well, that tattoo's better than a nurse tattoo, right? It's better than a nurse tattoo. It's better, but it's not what I'm doing now. So, like, I want that opportunity to make it better. I welcome that opportunity to make it better. But like, maybe we should name the physician's offices where these tattoos are coming from. So people can say, like, let's say you're a patient, right? And you go to blah, 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 whatever. And you get on Instagram and you look on Living Story Tattoo and you're like, oh God, who did that tattoo? And then you read and say, oh my God, that was done at my doctor's office. That's what I have to expect at the end of my road. Like, that's what they're going to put on me. No thanks. So maybe that's like, I don't know. Is it wrong? I'm not sure.
There's an element of accountability that's missing here, and I think that that's what you're alluding to. So the
Yeah.
accountability part is completely missing with nurse tattooists and with a lot of PMU tattooists too. And I'm not calling out the PMU field, they're awesome. But tattooing over a bone structure is completely different than tattooing over a reconstruction after an amputation. So it's just a totally different thing. So my belief is, just to clear the air on that, my belief is master cosmetic tattooing and then level up to medical tattooing. Or master traditional tattooing and then level up to medical tattooing. I believe that both of these sides should be mastered, and then you can learn how to work with the scar tissue and all the challenges that come with radiation and stuff. So what we see in the tattoo world is accountability, like traditional tattooing. Accountability. I have had masters that I respected come up to me and be like, oh yeah, so this client of yours walked in the other day and he did this, and you did this like a couple of years ago. And we approach it like, I just wanted to give you an opportunity to see how your work is healing. And they do that so that I can see what I need to grow. Now, I have done that to other like PMU tattooists, and they think that I'm like cutting them down or something like that. But I'm like, that's not the mentality. The mentality is, and I did that to the lady the receptionist who tattoos at my surgeon's office. I went up to her and I'm like, here's like 6 of your latest, like these girls all came in together because they were like really upset about this. They came in to me. I gifted them my whole day. I did them all. I fixed them all up, whatever. And I'm like, I just really want you to see how your work is healing. Because in my opinion, I took that time from my heart to talk to her about something that she could grow and benefit from. And she just like hates me, like won't let me see my surgeon, refuses to acknowledge my existence. I'm like, sweetie, accountability can be a beautiful thing. When I have a chance to look at an old tattoo, and I keep thinking of this one guy that I did before I first started learning about scar tissue, but this is one of the things that made me start learning about scar tissue. I did this tribal thing on this guy that I went to high school with him. I think his name was Ollie, and this was back in like, oh my gosh, 1996, 1997,
Yeah.
so long ago. And a couple years later, I took a picture of him and I thought I did a great job. And a couple years later, I was like going through my pictures and changing my portfolio. And I looked at it and I recognized something that I didn't see when I did it. So I was just learning how to see. I was just learning how to see, because it takes 2 to 5 years to learn how to see what you're doing wrong. That's why I think this foundation is so important. And once I saw it in that picture, what I had done wrong, I was just like, I was actually just looking for him on Facebook like last week. I'm like, I am so desperate. To somehow try to make it up to him, because I didn't know what I was doing wrong. And that's why I'm so serious about master this and then learn more. Because a lot of people want to skip the line. They want to take shortcuts. They want to like, I don't want to do this and I don't want to do this. I don't want to put time in. I just want to do the thing at the end. Like, I want to play Stairway to Heaven without learning the chords on the guitar.
Right. Well, and two, like when you talk about seeing your work, like how it heals, you get to know like, oh, well, I used this ink back then, and I've seen a lot of people on different forums that when they talk, maybe they're like areola tattooers or something, and they talk about certain lines of ink that they use. And then they talk about how they achieve a certain look. Like we've got this brown, and then if we want to lighten it, we add white to it to lighten it. Oh my God. So it's just, you kind of glean what you don't want to do and what you used to do maybe to what you're doing now. But that's why I'm really happy that these ladies that I've tattooed, either as a nurse previously or when I first started, are contacting me to have me add stuff and change things. And it's that's how you learn, right?
Well, that's the good part and the bad part though, because that means that your first couple years are practicing and you're making those mistakes without being aware of it, which
Yeah.
brings us back to why we're so serious about, you know, learning right, putting the time in, because it
Mhm.
is how you learn, is by making mistakes. And I moved back to my hometown for a year and a half and posted everywhere that I would do like half price. Like if I tattooed you 20 years ago, please come in, get like a half price fix up. Like I do have to charge you a little bit for my time because I'm
Right.
25 years in now, you know, uh, but I'm gonna not charge, I'm not gonna take my portion. I'm gonna charge you what the shop needs to make, and then I'm gonna
Right.
give you my portion of that. And nobody really took me up on that, and I was really sad. I really wanted to revisit those old ones. I
Mhm.
really wanted the chance to make it better,
Mhm.
because I appreciate accountability. I want to
Yeah.
learn from my mistakes. I want to be my
Yeah.
best. And I
Same.
know that mistakes are the way to learn. So we have to inspire people. Like, for example, microbladers are a good, and not dogging microbladers, it's just a different
Right.
skill set. But it's just such a good example of this because I get so many emails from them that they just like, they don't understand that that learning curve is quite a big one. But if
Mhm.
you have mastery with a machine in healthy tissue, that learning curve is much smaller.
Mhm. Yeah, I even saw somebody asked me if if I would ever soft tap an areola tattoo. I was like, "Oh my God, no." And don't ever say that you'll train with somebody that would. Like that is wrong. But it was a genuine question of hers. Like she probably did soft tap eyeliner or whatever.
Yeah.
And and again, like I don't want to ever put anyone down or say that I'm better than anybody else, but I'm better than I used to be. I know I've made um improvements and strides, and I take pride in the work that I do. And um and looking back, like you say, it is learning. um but you gotta dig in with both heels, and if you're going to do this kind of work, you can't be super sensitive about it.
Hmm.
You got to be able to step back out of your own shoes and reflect and look at your own work and be like, oh my God, like, oh. But when that lady walks out the door, you're like, huge
Hmm.
improvement.
So
um
what I'm trying to do, like my main goal is to reduce the risk of doing bad nipples.
yeah.
So when I started A.R.T, nobody was doing what I'm doing. Nobody was drawing. Nobody was really training like in a way that like honored the survivor, honored the person. Like I pioneered a whole new way. I broke new trail, right? And I thought that by kind of being my best, and proof of concept was if I teach other people, look at the work that they do, and I have this minimum standard. And this is the proof of concept is if we start at this minimum standard of mastery and healthy tissue, then we can do good nipples right from the beginning. And I thought that that would inspire the industry to eradicate the bad nipple tattoo entirely. But what I'm seeing is there are more bad nipples now than ever because we're missing that accountability part. And people are really into taking shortcuts, and I don't really understand why, because this work is a calling. And oh my gosh, I had the last part of my point there just kind of eluded me. Maybe you can add to that.
Well, it is a calling, and that's kind of what when you talk about like being a heartist, right? Like a heartist, because and I said this like even before you coined the term. I didn't say heartist, I didn't say that, but I would tell people when they would call me, maybe they were from another city or something in Ohio, and I'd say, well, listen, whether or not you choose to come see me, or if you go to like your local tattoo shop, if you find a person there that has experience, look at their work. Like, look at what their work looks like freshly, look what it looks like when it's healed, aged. If they have pictures like that, that's what you want to see. Ask them questions about what their machines are, ask them questions about their needles, ask them questions about their training. And most of all, make sure that they have all these basic things. Like, you have to have this minimally as like a basement level requirement, all of these things. But above that, is it in their heart? Like, can you tell, are they compassionate? Do they feel like this is what they're called to do? Like, make sure that you have that person. um because
I
That's the key, right? Whether or not you come to me, you give me your money, or you go to somebody else because you're a consumer and you're paying for the service. No matter where you go, make sure you have these minimal requirements.
I love the idea of empowering survivors, and that is a huge portion of what I try to do. Like, this is what makes, you see my posts, I'm like, here's what makes a good nipple tattoo, X, Y, Z, and I like make it like, this is what you need to demand as a minimum standard, like you're saying. However, anybody can pretend to be like, oh yeah, this is my calling, I love it so much. Like anybody can pretend that, anybody can say it. I am working with the people who mean it, because I can tell the difference, but a survivor can't, so I think the pictures of the work healed, like fresh, healed, and aged. Like I said, let's go 4 weeks, 4 months, 4 years, fresh, healed, and aged. I want to see that you did this. And if you don't and the survivors, it needs to be in their hands, because they just have this idea that I can just go get a nipple tattoo, and people who have maybe learned online and haven't actually taken in-person training, who have taken shortcuts, are very happy to take their money and tell them that they mean it from the heart. So it's kind of buyer beware, because you are consuming this. It's a service. So it is up to the survivors, demand the best. And what I'm trying to do is build a team, here's the people who I believe are the best. And there's bound to be somebody either in your area or on a bucket list place that maybe you want to travel to and go get your restorative tattoo and your retreat and have a little vacation and go home with your new tattoo feeling like a new woman or man should it be.
Yeah. Well, and to kind of draw on that, one thing that was really hard for me was I was, as a nurse, dependent upon the doctor making that nipple reconstruction, because I didn't have the artistic skill. I hadn't been trained, and that hadn't been cultivated, right? When you think about doing art, right, you cultivate it. You grow. You start out with a basic, like, oh my God, I look back at my sketches back then, like 2015. Oh, holy cartoon nipple. So as a nurse, even prior to that, I was dependent upon this doctor making this surgical protrusion topographically on the skin, because I couldn't make one appear. Nobody told me I had to, right? So my job was to tattoo this circle around this nipple. Well, then as women, maybe they had radiation, they weren't a candidate for nipple reconstruction, or they just didn't want it, they would come in, and then that's kind of like ooh, now what am I going to do? So then you go to this PMU technique, which is like, make a tiny circle, leave a halo, make a bigger circle, and it looks nothing like a nipple. But that's all I knew how to do. So with the accountability piece of that, you have to learn, not only are you having to learn with this how to create with light and shadow principles to make this nipple appear on a flat surface, but also if you get that nipple reconstruction come in that the doctor's made, guess what? You can't tattoo like that, like that's flat surface, right? Because it's not. It's a whole different little creature, and they have minds of their own, and you have to know what needle to use. You have to know what angle to use, how to adjust your hand speed, how to adjust your wrist versus what angle you're on. And these are things that you learn by people that have done this hundreds of times, because that's what it is. So when you're an artist, if you're going to learn how to do this, you need to invest in somebody where you're going to get proper training. And then that way, when the situations come in the door, you're prepared, right?
Because right now we have people, there's no regulation. And so we have people that do a course and then start teaching with no experience, and people don't care if they got 1 million followers on Instagram. They're like, oh, they must be good. And it's like, this person has done maybe 6 nipples. They took a class. And so I started saying just because you aced English in high school doesn't mean you're an English teacher.
You're not a professor. You're not a professor. So yeah. But and that's kind of like another just thing that I know we've talked about before, is just nipples are so they're like snowflakes, right? There's no cookie cutter nipple. They're not. So if you have a unilateral lady come in your door, you need to be able to offer her a realistic simulation so she looks the same on both sides. You need to be able to provide that. If she has nipple reconstruction or if she doesn't, you need to be able to know how to tattoo this skin. If she's got unsightly scars that kind of are on the perimeter of her. I had a lady like this last week. She had really unsightly scars on the perimeter of her lift on her natural breast. Then you have to know like how to tattoo on the other side and not draw attention to those scars, but detract tension away from those scars. And this is all things that you learn by dealing with a professional, like not nursing.
No, because I remember a couple of our earlier coaching calls and describing things to you, and you already had such a good understanding of scar tissue because you had already been tattooing nipples for so long. You knew what I was talking about. And then you get people that don't really have experience with scar tissue. So there's always there's so many things to consider. It's like all the phones are ringing. But I remember talking with you about you're like, okay, so we've got radiation on one side. I'm like, so you're going to have to tattoo both sides completely different to get an end result that looks the same. How are you going to do that? What are we going to do to get that look, right? And then and then you don't know until it's healed if you did the right thing or not. There's so many variables on every person.
And that's the thing. I always paint this picture, right, with the radiation. Change cellular level on this radiated side, so it's unpredictable. It will reveal to us how it's going to heal. We don't know. We can't predict it. So, this is, and then I kind of tell them like how we talked when I was being trained and how I've called you about things. So then when they come back for that touch up, every now and then these people come back in and they're point on, and you can't tell the difference between the radiated side and the non-radiated side because their tissue accepted the ink. And they're like, oh yeah, you told me it was going to be this and this and this, and none of it happened and it looks great. And I'm like, well, don't question it. We're just going to go with it. But I tell them up front and honest. And I think that's another thing with being a tattooer. When you educate that person, when they're signing your consent form, when they first come in, you need to have them be aware about things. Don't keep them hidden in the dark about stuff. But if that radiated side comes back like you told them, then they're not scared shitless either. They're like, oh yeah, she told me this might happen. So then we just adjust it. So.
Yeah. And that knowledge and that understanding is what gets you that language, because then you can anticipate, here's what I think this particular, because radiation on somebody who's darker toned is going to heal completely different on somebody who's pasty like me. And so you're like, this particular radiation I feel might do this.
Yeah.
So let's see if I'm right or not, and let me know how it heals. But you need to have such an understanding, such a deep understanding of how to read and anticipate to even have those conversations. Otherwise, you're just forcing that body to receive what you've been taught to give.
Yeah. And I tell them too, it's a process, right? That's why we have you come back for your second visit. So don't get too involved. If this radiation side looks different than your other side, don't get too involved in that. That's always something we deal with on the second visit. And that's why I'm so thankful that I do 2 visits now versus only how I was doing one previously, because it puts a lot of pressure on you as an artist, because you feel like I've set the expectation. I've told this lady you got 1 visit and you have to pack in all the color. That's no good. So then I tell them too, 2 visits lets me respect your skin, and it lets me listen to your skin, because your skin's, when I'm tattooing you, your skin's going to talk to me, right? Your skin's going to tell me I can take this, I'm doing okay, keep going, or your skin's going to be like, back up, don't touch me again. And when it says that, you have to stop. You have to, because if you don't, you're going to create a big problem. So I think when you're honest with them and you tell them hey, I'm doing this and this and this because I care about you and I care about your safety, I care about your skin, I care about your reconstruction, you as a person, I don't want to hurt you, then they are appreciative of that, right? They are. I had a lady come in here for a unilateral tattoo. I didn't numb her. She was like, oh my gosh, at the doctor's office, they put numbing cream on me and it took 90 minutes to do my tattoo. And I had blood running down my belly and it was awful. I swear to God, she can't make it up. She was like, I had blood running down my belly. It was so painful. And she kept putting numbing cream on and numbing cream on. It was hurting me. Well, she had a bed of scar tissue, like where her areola should be. And I basically had to do nothing but pointillism on the whole thing because you couldn't shade it. And I told her, I said, well, this was an unqualified technician that did that to you. I'm like, this nipple tattoo should be done in under 30 minutes. Like if you came to me with virgin skin with not, no, this should be under 30 minutes done. And you should never have blood right on your belly. That's awful. But she looks great now, right? Like given what she walked in my door with, she has a good result now.
So that being said, let's wrap this up. This is great. Thank you so much for everything. But if you could say something to every survivor about this, what do you wish every survivor could understand before they make the choice to get their nipples tattooed by someone?
I guess it would be that you have that you are presented with an opportunity to have a choice at this point in the game. So try to fill yourself with as much knowledge as you can. Speak with your artist, look at your artist pictures, take the time. First of all, the longer your skin sits there, the better, right? So take your time. Don't rush and get a tattoo. The longer out you are from surgery, the better you're going to have a result. Talk to previous customers, previous clients, right, that have been there. You really want to get that first person account, see if they'll show you what their work looks like, and just really take the time. It's not a race. You have plenty of time. As long as you have skin that's blank, you can tattoo it. So don't rush into anything. Make sure that you're educated. And then if it is a little bit outside of your price point, save. Work and save.
Yes.
Save. And or go online and maybe look for foundations and stuff that are willing to help pay for this. There may be some in your community. There may be funds through like your hospital system that are available that are untapped that you just don't know are there because nobody's told you. And hey, if you're like, hey family, you want to know what you can get me for Christmas? A couple Visa gift cards.
I have said that. I've said that. Yes, please go on.
Yeah. So I think that's the best thing is don't let price dictate you getting something that's going to possibly disfigure you. Don't make a rash decision and come away depressed and sad and feeling more broken than when you walked in the door, right? So just take time. It's not a rush.
It's an investment, right? Like, do you want to buy a beater car? Or do you want to buy a Lexus? Like, you know what I mean? Because I've had people tell me like really like entitled kind of like survivors, like just with like an attitude of like, I'd rather go for the free one. Thank you. I'm like,
save my card. Save my card.
Yeah.
Because later on, you're not going to be happy, right? I mean, isn't that awful? But you're not going to be happy and you're going to want somebody to fix it. And then, save my card.
So the way that I pay it forward in the Los Angeles area, I guess I am going to do a shameless plug here with this, but I live and work in the Los Angeles area, and sometimes people come here, artists come here to do private trainings with me. So the way that I pay it forward into the community is I collaborate. Now, I don't work with artists who don't have a solid foundation. So these are already master artists that are looking to level up by learning the way that I do things, and we collaborate, and I do better work collaborating with artists than I do on my own. I love it. I love it so much. So in the Los Angeles area, if there's any survivors that want to get tattooed and think that they can't afford it, come and get a collaborative tattoo, and we gift it. So that's the way that I pay it forward. And then the people that can afford to pay, and then they can support what I'm doing. And then there we go. We got a nice balance.
Absolutely. There's always some way you can give back. I mean, and we do try to have contests and stuff during the year, right? New year, new you. You know, like Veterans Day, if you're a veteran yourself or a wife of a veteran, spouse of a veteran, you know, I try to do giveaway like that. Um, I participate through a charity foundation here in Columbus. So if you're an Ohio Health patient and they have funding available, I can try to get funding. So there's all, and artists that do this really are selfless people, right? If they have their heart in the right spot, they really are selfless. We have to get paid enough to pay our bills. Like we can't do everything for free. We have to live. I have kids in college, like whatever. But if somebody calls me, you know, and they're like, hey, I live 2 hours away and I'm really going to struggle to see if I can get gas money to make it to your place. Oh my God, let me try to find something to help you. Right.
So here's what
Yeah.
I do for that. Anybody who travels to me, if they travel any more than an hour, because it takes an hour to get across LA, I'm like, no, this doesn't apply to you. But if they
Yeah.
travel more than an hour to come to me, I always give them $100 off. I'm always like, I appreciate that you took an entire day out of your life to come and spend this time with me.
Yeah.
And I'm going to balance this out by sharing the gift, you know? So we always try and work with people for where they're at, because what we want above all is happy survivors who love their body.
Yeah. Yeah. I'm 100%. That's why we're doing it.
Yeah.
So
So,
thanks for chatting with me today.
sorry, I interrupted again. I'm so sorry.
No.
Please go again.
No, I just wanted to say thank you, you know, for talking to me, because I know I am um, a little bit different from an average person who's maybe not a nurse or didn't tattoo as a nurse, and they didn't have the same experience as I have. And that's why I'm feel comfortable like candidly talking about nursing tattoos, because I'm not putting anybody down. I'm not saying anything bad, or I'm not saying anything that's wrong. I'm not spreading false information. I'm telling the truth because I lived it and I did it, and I know the ins and outs, and I've worked at multiple plastic surgery offices. Um, and I've talked to nurses that work at different offices. It's the same pretty much across the board. You know, I have no problems giving a realistic view of the nurse quote or front desk girl office or whatever expectation that you're going to walk away with. So, and you shouldn't be okay with getting that tattoo. You shouldn't. You should love yourself more than that.
Yeah.
So I have no problem talking about it, like candidly and openly, because I mean, you can't tell me that I'm wrong because I did it. Right.
Yeah. I really appreciate that candidness. I come from the same place in my heart because I made a lot of mistakes and scar tissue. Like I said, like that poor Ollie guy, man, I wish I could make it up to him, you know, like amongst others, right? So when I decided to start like sharing knowledge, like in an educational kind of way, I did it from a point of view as here's the mistakes to avoid.
Mhm.
I didn't want to be some teacher, make some big name for myself, because otherwise it would be called Stacey Ray, not A.R.T.
Mhm.
And I was just like, here's what not to do to minimize the risk to survivors. So thank you so much for coming
You're
here, for speaking
welcome.
openly. I would encourage any of our listeners, if you like what you hear, please like and subscribe. I feel really weird saying that because I never
No,
do.
yeah.
But for any survivors out there, I'm going to continue to have this conversation with all of the professionals that I feel have a strong message that you'll benefit from. So just like and subscribe. And if you see something pop up, you don't got to sit here and watch. We just talked for an hour and a half, Chrissy. We
Yeah.
did.
I mean, and we don't even know that, right?
I
Because,
know, I know.
you know,
So if you stuck with us through the whole thing, I would just say if you listen to what we're saying on this channel, just kind of put it on in the background while you're cooking or you're cleaning, and just kind of listen to the conversation, because there's always going to be something valuable to
Mhm.
glean from it. And maybe if you're a tattooist, you know, then it helps you to be better for your survivors. And if you're a survivor and you've already been tattooed, like who knows who can benefit from something that you may have learned from one of these conversations. So
Yeah.
Christina, it was so important to me I just really wanted people to hear what you had to say. So thank you so much for sharing it.
Well, thanks for having me. I appreciate it. I'll talk all day about nipples. My God, you know that.
Okay. Well, you have a great week, Chrissy. I hope
Okay.
to talk to you again soon. And everybody else, we love you.
Love
Happy
you.
growth.
Thank you.